all the major federal parties are promising some version of a pharmacare program. It's one of the hottest topics in terms of health care this election. 1 in 10 Canadians don't get their prescriptions filled because of cost. So joining me now is Dr. Daniel Raza. He is the chair of Canadian Doctors for Medicare. Thank you so much for being here, doctor.
Thanks for having me.
So this is a big ticket item. Some estimates as high as $15 billion a year once implemented. That is a lot of money. Make the business case for me. Why is it worth that huge upfront investment?
Yeah, well, I think it's important to put it in context. Yeah. We're already spending more than $30 billion a year on prescription drugs, so we're actually spending far more than that. And if we put forward the sort of plan that most experts are recommending, a universal public plan, we can actually reduce spending by $4 to $7 billion overall. And in fact, this $15 billion number, which came out of a report this summer, is even more optimistic than that. So I think there's a really strong case.
Okay, so let's look at what some of the parties are offering. NDP and Greens are both saying they're going to have full pharmacare in place by 2020. Liberals are saying they're going to negotiate with the provinces a little bit less in terms of the specifics of their plan out there. The Conservatives are saying that they're going to fill in gaps between where the private and the public are letting people fall through those cracks in the system. Can anybody fulfill any of their promises? Because on one side, you've got massive, ambitious plans that have been very hard to realize, and on the other side, it's sort of smaller piecemeal action.
Well, the good news is this is not a conversation happening in a vacuum. We're modeling our plans over best practices around the world. And in fact, the former health minister in Ontario, Eric Hoskins, who released a major report on this over the summer, has come out and said the parties that have the most detailed plans thus far are the NDP and the Greens. The Liberals are being a bit ambiguous, but we actually have a really positive way to move forward. You're right that besides the universal public plan, the Conservatives have put forward a fill the gaps approach. And actually, Quebec has this approach. They started it in 1997. But drug costs in Quebec have actually gone up faster than in the rest of the country. So if we're really interested in both giving people access to the medications they need and reducing costs overall, it's a universal public plan that we need to move forward.
I guess the question I would have then is, because the NDP's attack on the Liberals has been that they have promised this over many generations of government and never realized it. Both Conservatives and Liberals have been in power for as long as anybody can remember. Nobody has brought forth a complete, fulsome pharmacare plan. If it makes financial sense to do it, and if it will help overall with the health of Canadians, why isn't it a reality already?
Yeah. I mean, that's a great question. Problem is becoming a larger one because people are getting more chronic diseases like diabetes and hypertension and cancer. So medications are becoming more and more important. I think one of the reasons why we haven't seen an expansion of Medicare to include this is because it takes political will, right? When we do this, it will be the biggest expansion of Medicare since its inception. It will save employers, who pay very expensive private insurance plans for their employees. It'll save them money, it'll save Canadians money, but it's going to require an incremental cost to government, and that takes political courage.
Dr. Daniel Raza, thank you so much for being here today. Appreciate it.
Thanks, Ben.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.